Hyperpigmentation is today's topic, and that's because it is one of the biggest concerns for my patients in the clinic. It's one of the biggest concerns for the Dr. Sam's customer. And did you know that Google searches for hyperpigmentation have more than doubled in the last 2 years? So I'm going to share with you my detailed step-by-step strategy for getting it under control. So today I'm going to be covering the preventative things you can do with your skincare, the treatments you can use in your skincare, and some oral supplements that will make a difference. So make sure you stay right to the end. I'm Dr. Sam, helping you get closer to great skin days, just like I've done for thousands of patients in my Harley Street clinic. So why is hyperpigmentation such a big concern? Well, my take on it is it's because it's the biggest stealer of radiance. But it's also one of the easiest things to turn around in someone's complexion. And that's why I get such satisfaction out of treating it. Now, when it comes to the 3 things I see most frequent in clinic, they are, in order, solar lentigines or age spots or liver spots, those kind of fixed, round, flat brown marks that are pretty much a constant. Once you get them, they tend to stay the same. They might slowly get a bit bigger, but they don't come and go with the seasons like freckles do. And they are largely a consequence of excessive UV exposure, so they are an acquired thing. Number 2 is melasma. Now, this is a condition with a genetic predisposition, but it's also influenced by external things like hormones and drugs, so particularly the contraceptive pill and the HRT, and also your UV exposure. And often those 2 things mixed with the right genetic makeup, boom, melasma. Now, melasma has quite a distinct pattern occurring in these map-like splodges, often on the forehead, cheekbone, but not going inside that kind of curved orbital rim, which can make them almost look like melasmas following your sunglasses line. And it can occur on the top lip as well, rarely on the bridge of nose and on the jawline, but quite distinct from the pattern of solar lentigines, so quite easy to make the distinction. Then finally, we've got post-inflammatory hyperpigmentation, which can sometimes look red, but can also look brown, particularly in darker skin tones. And again, it has quite a distinct pattern because it essentially follows the pattern of the inflammation. Now, commonly we see this in context of acne lesions where persistent inflammation at the site of spots leaves a footprint of post-inflammatory hyperpigmentation. So with those top 3 conditions in mind, I'm going to share with you now my top 10 tips for managing hyperpigmentation, which will really give you a framework for how to go about building an effective skincare routine and general skin practices to reduce the chance of your pigmentation getting any worse. Now, step 1 might be obvious, but it's super important. Know what you're treating. Now, I've made it seem probably quite simple, but there is, of course, nuance to it. And I think if in doubt, get expert help, because as you can probably appreciate, the treatment for post-inflammatory hyperpigmentation is quite different to that for melasma. So when in doubt, get an expert opinion to help you build the right structure routine to tackle your particular pattern of hyperpigmentation. Now, many of the causes of hyperpigmentation are UV related. And in fact, even with post-acne marks, UV will make them worse. So UVA protection in particular is crucial because that is going to contribute to many of these problems that you're going to experience. So the key thing is to seek out the right kind of protection on a daily basis. Remember, we need UVA protection on our skin every single day of the year, even in cloudy autumn or winter days. And the way to determine whether or not you've got good UVA protection in your product of choice is to look for the UVA in a circle symbol, which means that you're going to be getting at least 1/3 of the level of UVB protection, which is based around the SPF. Now, this is why you'll always find us saying that SPF should be as high as possible, because of course, the higher the UVB, proportionately, the higher the UVA protection. So I always recommend broad spectrum UVB, and you'll be well covered if it's an SPF 50 product. So step number 3 is that it's not just about UV. It's also about visible light, particularly in darker skin tones, where visible light, particularly high energy blue light, seems to create more persistent, more significant darkening of the skin in areas of pigmentation. And in particular, this is relevant to melasma. Now, unless you're someone who's using non-nanoparticle zinc, you're not going to be getting any visible light protection from your elegantly formulated sunscreen, which is focused on protecting you against UV radiation, not visible light. So the ingredient to look for is iron oxides, which are actually present in most tinted products, particularly high coverage foundations, and also found in tinted sunscreens. Now, ideally, you'd look for around 2% or higher an iron oxide concentration. Sadly, not many brands yet are being terribly transparent about how much iron oxides are in their products. One of the best, though, is the Aven High Protection Compact. The limitation, of course, being that sometimes these products don't come in so many shades, and that can be quite restricting. But as a working principle, those are the kind of products to look out for. Next, we come on to antioxidants, which are essential if you are prone to hyperpigmentation of any kind, simply because hyperpigmentation pathways are ultimately triggered by free radicals, which are generated because of things like cigarette smoking, pollution, and UV exposure. And they can feed into that hyperpigmentation pathway. So the good thing about antioxidants, they quench those free radicals, neutralizing them and preventing the harmful changes that they will cause. Now, the golden child of antioxidants is, of course, vitamin C, which we all know is L-ascorbic acid and its esters. But did you know that there are other antioxidant molecules that we frequently find in our routine, such as niacinamide, retinoids, and bakuchiol, which is actually a very powerful antioxidant. So really, a skincare regime based on multiple antioxidant ingredients will have the best effect and will make a significant contribution in your fight against hyperpigmentation. So next we come on to the production of melanin, which is largely guarded by an enzyme called tyrosinase. So one of the most impactful ways to reduce hyperpigmentation is to reduce the activity of that enzyme, tyrosinase. Now, lots of different ingredients are able to do this, but perhaps one of the most commonly used is hydroquinone, which is available in the UK on prescription, and it's usually used at around a percentage of 4%. Now, in addition to hydroquinone, we also have things like azelaic acid, which are very effective and can be used at anywhere from 5 to 20% on prescription. Other ingredients include kojic acid and arbutin. So there's a real plethora of ingredients that will help us target tyrosinase. But the good news is some of the other ingredients I've mentioned before, such as vitamin C and bakuchiol, in addition to having antioxidant benefits, will also reduce the production of melanin, whether by just having an overall suppressive effect on the melanocytes or more specifically targeting tyrosinase. So I find that the best regime use multiple ingredients to kind of have a stacking effect and deliver not only the benefits in hyperpigmentation, but oftentimes will then give you other lovely benefits such as improved texture, unclogging of pores as well. So one situation, of course, that predisposes us to hyperpigmentation is pregnancy and to some extent breastfeeding. So it's always good to know what ingredients are safe to use when pregnant or breastfeeding. And actually you have quite a few options. So azelaic acid, which I think is probably my go-to in this context, is perfectly fine, as is bakuchiol, as is vitamin C, and you could combine that with some alpha hydroxy acids. And there you have a nice kind of integrated approach to targeting hyperpigmentation when pregnant. Now, the next way you can positively impact the amount of melanin in the skin is to reduce its transfer. Now, what that means is normally we have melanocytes that produce the melanin here at the factory, and the melanin gets transported into the keratinocytes or skin cells to protect the nucleus from damage from UV rays, like a sort of umbrella effect. So if you interrupt that transfer, that reduces the amount of melanin in the skin in situations where you're making too much of it. So one of the best ingredients for this is niacinamide, which can be used at anything from a percentage of 5 to 10%. And in addition to that, retinoids also have the ability to reduce melanin transfer as well. And the next way we can reduce melanin is to encourage its elimination. So once it's in those skin cells, we can push it out by using alpha hydroxy acids and retinoids, which both help increase cell turnover and exfoliation of dead skin cells. So encouraging its removal from the surface layers of the skin. So the next point I'd like to make is that multitasking works best, as I said before. So not only from the point of view of reducing the hyperpigmentation, but in context of choosing the right ingredients for what else might be going on in the skin alongside the hyperpigmentation. So if the cause is due to acne blemishes, then of course you're going to want to build a regime that tackles the root cause as well, that helps target the pigmentation. And that's where a combination of something like retinoids and azelaic acid and possibly even niacinamide really come into their own, because they tackle that whole cascade of events that's going on in the skin. Similarly, if you have solar lentigines, you're probably going to have some background changes associated with premature sun damage. So fine lines and wrinkles, coarsening texture, and even some prominence of the pores. So again, retinoids are going to be really fundamental. They help redensify the dermis, they help improve the appearance of fine lines and wrinkles, and they help brighten texture and refine pores too. Now, what's really key with hyperpigmentation is not to do things which might make matters worse. Now, I'm thinking of melasma. I've seen too many patients who regret going to have laser without having a proper consultation about the cause of their condition and the likely path. You develop melasma, it's likely to hang around for, a decade potentially. So it's not something you can solve overnight easily. And really what's much more sensible in the long term is to develop a proper long-term plan that manages the problem. So the same goes for blemishes, really. Again, rushing to do something aggressive where the risk-benefit profile may not be stacked in your favor when there's a chronic condition at play. Really be sure you're making the right decisions for your skin and not doing something that you're going to regret. Now, as a final consideration, we do have some options when it comes to treating hyperpigmentation orally. Now, the first one that comes to mind is on prescription, tranexamic acid orally, which is a medication more well known for being used by the gynecology colleagues to treat heavy periods. But in skin, by reducing the amount of growth factor to the blood vessels, we reduce the fuel going to the melanocytes, and that potentially suppresses the activity of those over-functioning melanocytes. So I've had great results in treating my melasma patients with tranexamic acid in addition to a good topical regime. And of course, there is the option to try treating with tranexamic acid topically, albeit that it's a bit less effective than it is when given orally. In addition to that, we have a great antioxidant that we can take by mouth called Polypodium leucotomus that's found in the HelioCare sun supplements, and I find that to be a good adjunct as well, and has lots of good antioxidant benefits in the skin. So when it comes to hyperpigmentation, we have lots of options, and I think you probably appreciate now that it is quite a complicated pathway. However, when we tackle it at 3 or 4 points in the journey to excess pigmentation, we can make a really big impact and at the same time get those nice skin improving benefits from multitask ingredients along the way. So I hope that made planning a treatment regime a little bit easier for you. And if you did find it helpful, please do feel free to share and hit like. And I'll see you again soon for more content. Bye for now.